All right, we're live. Our first discussion, trying to get some semblance of order. We'll call this abnormal activity. We'll kick off with the matrix. All right, so where'd you like to start? Neo. All right, so we're going to go with Neo. All right, what did you see?
He kept to himself a lot. He was very kind of like put down in his job, and kind of seemed like he was just like going through the motions every day in the beginning of the movie.
Right. And let's say that he came to clinical attention with those details. And you found that exactly what you just described was, in fact, causing clinically significant distress or impairment. Begin to formulate a differential diagnosis for me.
Major depression.
Depression, okay. And for students, we're actually live on Periscope, so you guys are free from needing to record.
This is kind of cheating because it was something we talked about earlier, but schizoid.
Yeah, schizoid personality, right? He seems somewhat content. And can you describe his apartment to me?
I mean, he has all like I'm not sure if I'm remembering this correctly, but he has all like the computer stuff. It's like small with like, I think it's just like the one window. It's kind of cluttered, and it's kind of like very, I would describe it as like self-contained. Like everything he needs is like in that.
Is there? Okay.
Yeah.
Personal items on the phone, pictures of family. I mean, very cold, right? Very distant, very consistent with schizoid personality, self-contained. Not a whole lot of warmth or personal items, flowers, pictures, etc. All right. So maybe schizoid personality in our protagonist. All right. Give me more. What else? What else did you see? Not necessarily inside the apartment, but or work for that matter. But what else?
He was very willing to entertain these ideas and propositions that if someone came up to me, I'd be like, what? But he just didn't really question it, and kind of embraced these like very odd things that were happening to him.
Yeah, I mean, Morpheus almost comes off as schizotypal personality. Some magical thinking, tells a story. All right. And ultimately, Neo appears to, like you said, be convinced and follow. Anything else?
I think there's a lot of talk about like belonging, where he was like, "Oh, do you ever feel like you don't belong here?" Or, you know. So I don't know. That was like kind of interesting that he was almost like, even though he was content keeping to himself, like he did have like a longing to belong. Yeah.
All right. So in a way, maybe even especially the beginning of the film, feeling uncomfortable in his skin, who he is, maybe searching for some identity, right? Which would probably say that he might be regressed or otherwise fixated at an adolescent stage of psychosocial development, as per Erik Erikson, right? Identity versus role confusion. Maybe not fully understanding who he is, uncomfortable in his skin. All right?
You could say he has like drug-induced psychosis
So,
after he takes the pill.
The blue. He takes the red pill, right? Yeah, he takes red. So that said, let's break this down. Drug-induced psychosis. First, you're going to have to explain to me what you mean by or where you saw psychosis.
Well, you could be saying that he's having like delusions, that the world isn't real. He's having like vivid hallucinations about like an alternate reality. What else?
He could be hearing, hearing all these things.
Doesn't really have like negative symptoms that much, more so like in the beginning.
Okay. So definitely some positive symptoms here of delusions, fixed beliefs, and maybe perceptual disturbances. Okay? So, okay, I'll buy psychosis. Drug-induced?
Well, it happens like directly after he takes the pill, so.
All right, so let's try to focus on what pill this may have been then. Give me the substances that we understand can physiologically induce psychosis.
It didn't look like it, like marijuana.
So cannabis, right? So was it an edible?
Sure.
Were there edibles back then? No. Cannabis has to be on our short list. Cannabis can, in fact, induce psychosis. Yes.
LSD.
So hallucinogens, yeah. And the next example there would be LSD. Okay.
PCP.
PCP, yeah. Uh-huh. Any hallucinogen can induce psychosis. So, Micah is one of the main characters in Paranormal Activity, who, that is, the film may be flipped as a fictional case of psychosis when seen through the perspective of Micah. Whether or not you agree with that, I'll leave up to you, but what I will try to impose upon you is that his name serves as a very nice acronym for the substances that may induce psychosis. You already have the C and the H. You're missing 3.
Meth.
Yeah,
Alcohol?
good. So meth and other stimulants, alcohol, and you're only missing the I.
Inhalants.
Yeah. Wow. If we take these in order, any evidence that Neo is using a stimulant? Beyond the blue pill.
I don't think so.
Okay. Do you inhaling anything? Again, we don't know. We kind of rendered an opinion on the likelihood of cannabis here. Alcohol? Seem drunk. And by the way, anything alcohol can do, benzos, sedatives can do as well. So when I say alcohol, it's always all-inclusive. The only exception to that rule is that while alcohol can induce an anxiety disorder, these sedative hypnotics cannot. That's the only time you see a differentiation there to remember clinically. All right? Otherwise, alcohol, even in the setting of this scenario, a drug-induced psychosis, we could think benzos here too. But in that case, I mean, I really don't see much. There is one. Well, can this be benzos? Somebody give me a street name for a benzodiazepine, other than black beauties, reds, and yellows.
Okay.
No idea.
I didn't even know those.
Blues or bluebird. Now, I don't see a bluebird in this film. Snow White, different issue. But blues. It's interesting that the pill is blue.
Does he take the blue one or the red?
Red.
Oh,
Red.
take it back. Well, doesn't matter. Reds. Right. Reds, blues, yellows. So maybe this is benzo. Something to consider. Any evidence that in this film that supports this being a drug-induced psychosis other than this metaphor for a benzo, street slang for a benzo being blue or blues? What gets him out of his
Yeah,
apartment?
he goes to like the bar, where like the club, wherever he went, right
Yeah.
before going to meet Morpheus.
Yeah, might be something there. Ecstasy is a substitute amphetamine, right? It's a stimulant, so we might have something there. Even though before he gets to that bar, that club, what gets him out of the apartment in the first place?
Oh, the like White Rabbit, the people were coming. It seemed probably like a drug dealer or something.
Right? And even before there's a knock on the door, isn't he given a quick warning? Knock, knock?
Mm-hmm.
What is that computer message say
It said knock knock.
before that?
Oh. Follow the white rabbit?
Yeah.
Or, yeah.
Yeah. Might that point us in a direction given our short list here?
LSD.
Yeah. How?
Awesome.
I don't know, it just makes me think of Alice in Wonderland. Yeah.
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 Yeah. What's Alice in Wonderland really about?
LSD.
LSD, right? By the way, what is Alice doing just before she goes down that rabbit hole?
Isn't she eating?
She's not eating now.
I don't know.
I don't
It's been
remember.
it's been too long.
No? It's been too long.
Following the rabbit, right?
Just before.
She's
Just
in
be-
the garden.
Yeah, she's picking daisies to make a daisy train. Right? Daisies are the family of morning glory.
Oh.
Right? Morning glory seeds are hallucinogenic. Right? It's an actual chemical constituent of LSD. Morning glory. That's exactly what she's picking. Right? Morning glories. So, the fact that she's picking morning glories to make a daisy train just before she goes down that rabbit hole paints Alice in Wonderland as an LSD trip. And The Matrix is a remake of Alice in Wonderland. This is an LSD trip. Now he chooses the red pill, right, to unplug, meaning that the blue pill would have kept him in that alternate reality, would have kept him tripping. If you actually put LSD, right?
Wait, so
He-
I thought the trip was which is the trip? The Matrix or
I think
the real world?
the Matrix is the trip,
Okay.
right? The red pill unplugs him,
Okay.
right? So that might be benzo. But if you want to go with the blue pill, the one that he doesn't take, that would have plugged him back into the Matrix, that would have plugged him back into the alternate reality, that's consistent with LSD. By the way, if you put LSD under black light, what color does it light up?
Blue.
Yeah. Right. So, Matrix may be about LSD. And it may be about a case study. It may be a fictional case study of LSD, hallucinogen-induced psychosis.
So when the agents take him and put the bug in him and everything and close his mouth shut, is that part of the original trip,
Yeah.
you think? Or
Yes. Yeah, because he's under some influence there.
So it was like
of what?
Probably LSD.
Oh, but it's before he takes the pill. So you're saying it's like...
But
yeah.
the pill he takes
Yeah, it's
unplugs him.
unplugs him, okay.
Yeah.
so is he like withdrawing then when they like take the little bug out of his body and he's like halfway he's like with them but not
Unfortunately, not that straightforward, and this is certainly important for the shelf exam. There is no identified withdrawal phase for hallucinogens. Right? There might be some psychological signs, but no true identified, especially no identified physiologic withdrawal state from unplugging from that alternate reality, which is hallucinogen use. Anything more with Neo here? Oh, by the way, let's just talk a little bit about hallucinogens then. All right, LSD, PCP. And acute intoxication of LSD looks very similar to a panic attack. Right? So his panicking with the agents prior to meeting Morpheus, LSD. Now things get a little weird, even though he does unplug, because we still see some elements of LSD intoxication. So who knows what's really going on? But one of the things that I wanted to briefly discuss is that this medication, this drug, LSD, was used medicinally back in the 50s and 60s. I believe it was Sandoz Corporation actually dispensed it as part of their, every 2-week salary to people who work for Sandoz. There's an interesting, if you could look it up, I think it's called Bicycle Day. And I believe it's a Sandoz worker having taken some, riding home from work on a bicycle, and how frightening it was for the buildings to come alive and try to grab him. Bicycle Day. Although that might have been also Hoffman as well. I may be getting my stories confused. Either way, it's a remarkable story. Made illegal, late 60s. Congress had to act. A TV personality's daughter apparently jumped from a roof. Many stories as to why she jumped. It could have been suicide. Whether it was suicide or not, honestly, don't know. Maybe she thought she could fly. Again, honestly, don't know. The other thing about LSD, and again, we don't know in terms of this particular event, but another thing about LSD is that there's a lot of time and space distortion. And if an individual like Alice, who is through that rabbit hole, having time and space distortion, ends up on a 3-story building, the view from the top can look incredibly small compared to where she just came from. So it may be very simple for her to step off thinking no big deal, but 3 stories is a big deal. So that might be a byproduct of that time-space distortion as well. So the reason why people may jump from roofs under the influence of LSD could be multifactorial, including, of course, a suicide attempt. For this particular individual, we honestly don't know. There's a lot of controversy around it. What we do know is that Congress acted, and it was made illegal. Right? LSD and other hallucinogens are making a comeback medicinally. They are going through phase 3 placebo-controlled clinical trials. There are effects that are very, very positive and very, very, I think, interesting. And I think that we will probably have some FDA approval with regard to these agents. Unfortunately, what happened with the counterculture back in the 60s took psychiatry back a half century. But we're getting there again. Panic, right? Now, again, and no physiologic withdrawal state. PCP, no physiologic withdrawal state. How does the intoxication state of PCP differ from that of LSD?
Like really aggressive and
Yeah.
If you ever want to look at, let me think for a second, for LSD, again, sticking with LSD just for a second, there are both behavioral and physiologic effects during the acute intoxication phase. Again, the physiologic effects are going to be primarily panic-like. So think of autonomic arousal, increased sympathetic tone. The psychological effects, let's just separate them out. Unfortunately for us, especially those who have to sit for a shelf exam, are across the board. Manic-like, anxiety-like, psychotic-like, depressive-like. I mean, it's the full spectrum of mental disorder. All right. So unfortunately, it's going to be just a low threshold of specificity when it comes to the psychological factors, signs and symptoms of acute LSD intoxication. So you're going to have to rely on the physical state, the panic-like symptoms. PCP. The behavioral symptoms are what? You just said it?
aggression and violence.
Yeah. And the physiologic are listed in the DSM. Now, for both, I would refer you to the Terminator. And by the way, if you watch The Matrix, an awesome movie to watch back to back with it would be the Terminator. Anybody here see the Terminator? Okay. Well, at some point this weekend, simply get on your favorite YouTube channel. Check out the Terminator police station scene. That's the scene that's hallmarked, introduced by Arnold's tagline, "I'll be back." Right? The minute or 2 or 3 that ensues is his leaving the precinct, searching for Reese and Sarah, and then driving his car through the wall, and in a state that only PCP could really allow to happen, annihilate the entire precinct, leaving everybody in its wake, with the exception, of course, of the 2 protagonists that do escape. Spoiler alert. You'll watch that police station scene, and you will never forget the psychological factors, signs and symptoms that define PCP intoxication. Matter of fact, there's a scene just prior to his driving his car through that wall where Reese and Sarah are trying to convince the detectives that they're being pursued by a android from the future. Now, if you're sitting there as a psychiatrist with those detectives, what's going through your head, generally speaking, when these two individuals are trying to convince you they're being persecuted by an android from the future who came through a time portal?
It's not true.
It's probably not true.
Yeah.
AKA, as we would say in clinical medicine, not reality-based. So maybe a form of psychosis. It's fairly clear that Reese is the one who is driving this bus, and Sarah is along for the ride. If that is the case, and there is some dynamic of what we would refer to as shared psychotic disorder, what is the single or next best step? What do you do in cases of shared psychotic disorder?
Separate the people.
Exactly. That's exactly what they do. Reese goes with the psychologist. Sarah stays with the two other detectives. Reese, in the room with the psychologist, is bouncing off the wall. He's not getting any better. We would have expected that. There is no medication provided him. We don't expect him to get better. Sarah, on the other hand, once out of Reese's company, actually drastically improves. She gains insight. And I'm going to paraphrase. The diagnostic criteria for PCP intoxication in terms of the physiologic signs and symptoms, it actually spells out the word Terminator. So it's there. It's all there. I did not assign the Terminator. I would have thought that everybody here would have seen the Terminator by now. But it's but it's a wonderful movie to pair with The Matrix. All right, so that's PCP, and by the way, ketamine, very similar. Mm-hmm. All right. Trying to think. Anything else with regard to Neo? Is there any single best answer we would guess? Let's say schizophrenia is answer A, schizoaffective is answer B. What might be hidden in answer D that would allow you to choose that as the single best answer?
Wait, I choose D as the single best answer?
Yeah. So you're going to skip
Okay.
over A and B. You're going to say, oh, schizophrenia, probably not. Schizoaffective, probably not. Oh, there it is.
Like the timing?
Huh?
Do you mean the timing?
No. So it's not going to be brief psychotic disorder, 1 day to 1 month,
Yeah.
nor schizophreniform disorder, 1 month to 6 months. Focus on the agents. If Neo came in here and said, hey, listen, this is what's going on, and he mentioned the agents, what does Morpheus tell him about the agents, about those programs that then Neo would convey to us? I want to know the content of his delusion.
They could be anyone.
Right? What's that?
Fragoli.
Yeah. Yeah. This is the drug-induced Fragoli syndrome.
Yeah.
Right? So that's the Fragoli delusion. Yeah. And oh, by the way, make no mistake, Neo's computer program, what's the only computer program he fails? Training program.
Kung Fu. Was it Kung Fu?
Well, no, I mean, yeah, sure. Kung Fu, yeah. He gets beat by Morpheus the first time. What else, though? Matter of fact, when they plug him in here, there's a lot of backlash.
Oh, the jumping?
Yeah, which is consistent with the history of LSD, right? It's the reason why it was made illegal back in the 1960s, right? Failing the jumping program, I think, is very consistent with what we understand about LSD. I don't know if that was intended, but boy, does that help support the idea that The Matrix is about LSD-induced Fragoli syndrome. Any other characters you want to discuss in The Matrix? All right.